Hello, my name is Dr. Dave Harper from M.O.S.A.I.C, and today's article description, every once in a while we do these videos talking about some type of an important piece of information that comes across my desk. This one came from the Toronto Star. It's labeled The Growing Impact of Dementia. Are we ready? This came across my desk a couple days ago, and I wanted to just read some of the information here. The tide of dementia is swelling and no country will be spared. There are no effective drugs, no cure, and in Canada, no national strategy for a major health issue that will only keep growing. This is not a problem for old people, it's everyone's problem. There is no question, if dementia doesn't already affect you, it will someday. You could become a patient or a caregiver or a taxpayer increasingly burdened by dementia's spiraling costs. It's a growing public health crisis that will overwhelm countries like Canada if not prepared. And so this idea of dementia and being able to protect the brain, what if there was a way that you could know that you might have some breakdown in the brain before dementia actually becomes a reality? Because if it's true that every chronic illness and disease goes through a continuum where there's small little changes and small little losses to the function, small little shifts before it actually becomes a full-blown diagnosis, if we could have a conversation early in the process when there was that type of early warning sign, not early detection, but early loss of function, it's a completely different conversation. And it drives me crazy when we hear in the medical community it's about early detection. It's not about early detection. Early detection is still detecting that negative reality. It's about early functional evaluation. And early functional evaluation, the loss of that function, is what really comes from a philosophy and a premise that life is a sport and you want to live it. And that's the way we talk about it here at M.O.S.A.I.C. And so this whole concept of what dementia means, if there was a way that you could have your mind and your brain tested to know how well it's doing under stress, ahead of it being an issue, would you engage? Well, that's what we have. We have a functional EEG in the clinic. Get your brain tested, have a conversation with me, call the number at the end of this video, and let's have a conversation about what it means to begin a protect your brain and a bulletproof your brain kind of program for you to make sure that you don't become a statistic, because it will impact about 50% of the people that reach 80 years of age. So if we do the math with the demographics of the boomers and the costs and the beds that would be associated, we're not going to have enough resources to deal with this tsunami of dementia that's coming. So give me a call, follow the number at the end of this video, and let's get connected.